Gucci Mane and Keisha Kayor open up about navigating his mental health journey. Gucci Mane and his wife Keisha Kayor recently shared insights into how they manage his mental health challenges. Earlier this month, the Atlanta rapper 45 released his third book, Episodes, The Diary of a Recovering Madman, in which he revealed his diagnoses of bipolar disorder and schizophrenia. The memoir explores his personal life, career, and past legal issues while providing context to the mental health struggles he faced. On Monday, October 20th, the couple, married since 2017, appeared together on The Breakfast Club to discuss how they handle his episodes and recognize early warning signs. "I have a system," Kayor, 40, explained. "I remove his apps from his phone. First, Instagram goes, then everything else. If I have to change his passwords, I do it, because I don't want the public knowing he's experiencing an episode." She added, "I manage it all at home. Now, I can catch it before it escalates. How I know is when he withdraws, doesn't want to talk, skips meals, and doesn't sleep. Even his texts change. There's a pause after every word." Gucci Mane described how unaware he would be of his behavior during these episodes, which felt like being in a psychosis or a warped world, with voices in his head and paranoia about others plotting against him. Kayor said she often had to switch into mother mode to ensure he received proper care during these moments. "It's frightening, but I knew I needed to stay by his side," she said. She recalled that he would sometimes say hurtful things, but she reminded herself that "I'm not talking to Gucci during those times." Schizophrenia, affecting roughly 2.4 million adults in the U.S., is a severe mental disorder that distorts the perception of reality, often causing hallucinations, delusions, and disorganized thinking, according to the Mayo Clinic. Bipolar disorder, a manic-depressive brain illness, triggers extreme mood and energy swings. Patients experience periods of elevated mood and hyperactivity, manic episodes, followed by depressive stages of sadness and low energy. Per the National Institute of Mental Health, these shifts can disrupt sleep, thought processes, and everyday functioning, making work, school, and relationships challenging. During the interview, Gucci, born Roderick Davis, recounted a 2020 episode amid the COVID-19 pandemic that motivated him to confront his mental health and seek help. "After that, I realized I had to hold myself accountable and prioritize my health. I didn't want to experience another episode. If I needed therapy or medication, I was ready to do whatever it took to get better," he shared. At the time, Kayor was pregnant with their son, and Gucci worried about starting a family while managing his mental health. "I didn't want to raise a family while struggling. I couldn't risk having an episode I couldn't recover from. So I began doing the work and getting help." He began therapy, started taking prescribed medication, and learned to identify his triggers, including substance use and stress. Today, Gucci credits these steps with his improved stability, noting that he no longer experiences episodes. "You have to do the work yourself if you truly want to improve," he said. "Others can support you, but you have to want it more than anyone else does."